How to compare injectable weight loss drugs. You may have heard the buzz about injectable medicines that many people are now using to help them lose weight and wondered if one of them could be right for you. Reaching and sticking to a healthy weight can be hard, but it does come with many health benefits. It can lower your chances of diabetes, heart disease, some cancers, sleep apnea, and many other health conditions. While diet and exercise alone may get you there, these weight loss drugs can be a new lease on life for people who have diabetes or obesity. But you also may have lots of questions, including whether they really work and how. You might also wonder how these medications, including Mounjaro, Ozempic, Wegovy, and Zepbound, compare to each other and why you might choose one over another. These drugs do have a lot of similarities, but also important differences. For example, all of them include a class of drug that's known as a GLP-1 agonist. An agonist is a drug that works by acting like a substance that your body naturally has. GLP-1 stands for glucagon-like peptide 1, which is a hormone your small intestine makes. When blood sugar goes up, GLP-1 encourages your body to make more insulin to lower blood sugar. These drugs do the same thing. How do GLP-1 agonists help with weight loss? They may make you feel less hungry by keeping any food you eat in your GI tract for longer. This makes it take longer for you to feel hungry again after a meal, so it's easier to eat less. They may also send signals to your brain that tell it that you're feeling full. Of course, like any drug, these medicines do have downsides. They can come with side effects, including nausea. They're costly and may not be covered by health insurance. You may need to take them indefinitely to maintain your weight unless you make other lifestyle changes. And because they're relatively new, it's not yet clear how they will affect your health over many years. Because of all this, it's a good idea to talk to your doctor if you think you might like to try one of these to lose weight and improve your health. It will help to learn all you can up front before you decide to give any of these new drugs a try. Make sure you have all your questions answered so you can make an informed choice that's right for you. Semaglutide versus tirzepatide. Semaglutide is the active ingredient in Ozempic and Wegovy. It works as a GLP-1 receptor agonist to treat type 2 diabetes. People also use it to help them lose weight. Tirzepatide is the active ingredient in Mounjaro and Zepbound, which also can treat type 2 diabetes and encourage weight loss. Tirzepatide is a GLP-1 receptor agonist too, but it also works in a second way, as what's known as a GIP receptor agonist. GIP, short for glucose-dependent insulinotropic polypeptide, is another hormone your body makes after you eat. So, both semaglutide and tirzepatide work by acting like hormones your body normally makes after you eat. They can make your stomach empty more slowly so that you won't want to eat again as soon. They also send signals to the brain that tell you you're full. The main difference is that tirzepatide mimics two hormones, while semaglutide mimics one. Ozempic versus Wegovy. Ozempic and Wegovy are different brand names for the same injectable drug, semaglutide. The difference is that Wegovy is approved to manage weight in adults and kids 12 and up who have obesity. Ozempic is approved to lower blood sugar when you have type 2 diabetes. You can also use it to lower your risk of a heart attack or stroke if you have diabetes and heart disease. Wegovy also is approved if you are overweight with at least one related health condition, including high blood pressure, type 2 diabetes, high cholesterol. Ozempic versus Wegovy dosage. Ozempic and Wegovy are really the same drug, but you will take them in different doses. You take Wegovy as an injection in your belly, thigh, or upper arm once a week at the same time. You'll start with a lower dose and work your way up to 2.4 C. You also start Ozempic at a lower dose. You'll work your way up to a dose of 0.5 Wegovy each week. If you're taking Ozempic for diabetes, sometimes you may need to increase the dose to 1 milligram per week if the lower dose isn't enough to get your blood sugar under control. Ozempic versus Wegovy side effects. Common side effects of Wegovy include nausea, diarrhea, vomiting, constipation, belly pain, indigestion, dizziness, bloated stomach, gas, low blood sugar, hypoglycemia, gastroenteritis, GERD, headache, fatigue, nose and throat infections, nasopharyngitis. Common side effects of Ozempic include nausea, vomiting, diarrhea, belly pain, constipation. Both Mounjaro and Ozempic can help you lose weight, but they're primarily indicated to treat type 2 diabetes. They haven't been studied in people who've had pancreatitis in the past. They also aren't recommended if you're pregnant. You'll take Mounjaro in a higher dose, starting at 2.5 milligrams and working your way up to 5 milligrams once a week. Both are taken as an injection once a week. Without insurance, Mounjaro and Ozempic may cost about $1,000 per month. Neither one is available as a generic. While they work in similar ways and are approved for similar indications, they are different drugs. Mounjaro versus Ozempic for weight loss. While they are approved for diabetes, both Mounjaro and Ozempic also make people lose weight by helping you to feel full longer. Ozempic acts like a hormone your body makes. Mounjaro works similarly, but it acts like two hormones instead of one. Compared to Ozempic, Mounjaro might work even better for weight loss. One study showed that a 15 milligram dose of this drug taken every week led people to lose more than 20% of their body weight. Ozempic can help you lose 15%, 20% of your weight on average, but many people might lose closer to 10% of their body weight. You'll most likely have to keep taking them to keep the weight off. If you need to lose a lot of weight, you might need to consider other options, including weight loss surgery. Experts recommend being cautious about deciding to take Ozempic or Mounjaro for weight loss so you can make an informed decision given their side effects, costs, and other factors. Mounjaro versus Zepbound. Mounjaro and Zepbound are brand names for the same drug, tirzepatide. While Mounjaro is approved for type 2 diabetes, Zepbound is approved for weight management in adults with a BMI of 30 or more. It's also approved if you're overweight and have another health condition including high blood pressure, high cholesterol, type 2 diabetes, obstructive sleep apnea, heart disease. Mounjaro versus Zepbound dosage. You'll take Mounjaro and Zepbound in similar doses. The maximum dose is 15 milligrams per week. You will start at a dose of 2.5 milligrams and adjust it over time to reach the desired effects. In addition to considering how it's working, you'll have to take any side effects into account. Mounjaro versus Zepbound side effects. Common side effects of Mounjaro include nausea, diarrhea, reduced appetite, vomiting, constipation, indigestion, belly pain. Common side effects of Zepbound include nausea, diarrhea, vomiting, constipation, belly pain, indigestion, injection site. Reactions: fatigue, hypersensitivity reactions, burping, hair loss, GERD. Other differences between Mounjaro and Zepbound. Although they're the same drug, your insurance may or may not cover Mounjaro or Zepbound, depending on your coverage and whether you are taking them as indicated or off-label. Both of them are costly to pay for out-of-pocket. They may cost about $1,000 per month. Which weight loss drug is best? Mounjaro, Ozempic, Wegovy, and Zepbound work in similar ways for weight loss. Ozempic and Wegovy are both semaglutide. Mounjaro and Zepbound are another drug called tirzepatide. Clinical trials have shown that taking either semaglutide or tirzepatide can make you lose weight, but the first studies didn't compare the two to each other. To look at this, one recent study looked at weight loss and side effects in adults who were overweight or had obesity. Some of them got tirzepatide, while others got semaglutide. It turned out that people taking tirzepatide lost more weight than those taking semaglutide. This was true after 3 months and a year. The side effects of both drugs also were similar, but we need more research to really understand the differences over the long term and how taking either one of these drugs affects your health. The best option for you may depend on how much weight you want to lose to improve your health and whether you have another weight-related health condition, such as high blood pressure or high cholesterol. You also may need to consider other things to decide which drug is best for you, including your doctor's recommendation, your insurance, availability, side effects. Ask your doctor if they recommend one of these drugs to help you with weight loss. If they suggest it's a good option to consider, then you should talk through your options and the pros and cons of each. Takeaways: Mounjaro, Ozempic, Wegovy, and Zepbound are all relatively new weight loss drugs. They both work to slow down your stomach and GI tract. They also can send signals to your brain that help you feel full longer and eat less. While some of them are only approved as treatments for type 2 diabetes, all of them can make people lose weight. Talk to your doctor about whether they recommend you try an injectable weight loss drug along with diet and exercise to improve your health. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. AFC Urgent Care Joplin, located off 3rd and Rangeline behind Starbucks. American Family Care, the right care, right now.